Well, my story with nutrition goes back to probably close to 30 years ago when I was interested in nutrition for performance, but actually over time I became much more interested in nutrition for health. I have had a career over 20 years now at the University of Miami Miller School of Medicine, where I've been one of the few professors who has been conducting research in nutrition, dietary supplements, exercise training. So in my career at the University of Miami, I have probably conducted at least 25, maybe 30 clinical trials looking at all of these various factors related to nutrition, dietary supplements, and exercise. I've probably accumulated several $1 million in the research portfolio during that time. I've published close to 200 peer-reviewed scientific articles. A lot of the key findings were in things that are very significant categories today. For example, Alzheimer's disease, MS. These are two of the three leading neurodegenerative disorders that, unfortunately for those people, conventional medicine really has no good answer for. But through the power of nutrition, we showed very impressive findings in that area. HIV, we've looked at studies there. Non-alcoholic fatty liver disease, obesity. Again, these are the leading diseases and disorders that are affecting our society today. One of the most exciting studies to date in my career was the study on looking at the effect of this dietary supplement formula, in particular this polysaccharide-based or sugar-based formula on Alzheimer's disease, and we showed quite remarkable findings. After 9 and 12 months of people with moderate to severe disease being on this supplement, we actually showed improvements, clinically and statistically significant improvements in cognitive functioning. That's unheard of. I challenge anyone to find a better study than what we showed in this study with people with moderate to severe Alzheimer's disease. We also showed a lowering of inflammation, inflammatory markers, which are so significant. Inflammation is the underlying aspect of all chronic disease today. And then finally, the other really cool finding in this study was we showed from baseline to 12 months approximately a 300% increase in adult stem cell production. How about using the power of nutrition to turn on your body's own intelligence to be able to make its own stem cells? That's the power of what this product does, and that's why this product works so well. So as someone who is not only a scientist, but a person who lives this life of health and wellness, it was so exciting to me. The findings that we had in the Alzheimer's study were just so profound. I had caregivers calling me and saying, "Dr. Lewis, I cannot believe what my loved one is doing today. He or she is now remembering names, places, events, things that we did together." These people were calling me in tears, so I get chill bumps every time I tell the story of how the people in this Alzheimer's study responded to basically enhanced nutrition, allowing the cells to function properly and restore and repair the body's damage. So for me as a scientist, it's beyond just what we showed in terms of the data that we published. It's actually the human interest story. It's actually getting that kind of feedback back from the primary caregivers who are so affected. Remember, with Alzheimer's, it's not just the person who gets the disease, but you actually have the caregiver who also gets very sick and ill because it's so stressful taking care of someone with dementia. So the human interest aspect of this was just beyond anything that I had shown in my career to that date, and it has really propelled me and motivated me. It's why I feel so passionate, among other reasons, to help spread this message of health and wellness to the world.